Hi, my name is Nicole Fox. I'm a PA practicing rural family medicine in Southeast Utah with San Juan Health. And I'm here for our final video in this series, which is talking about treatment options for sleep apnea. When most of our patients think about treatment for sleep apnea, they think about CPAP, or continuous positive airway pressure. CPAP delivers a continuous flow of air through the upper airway, helping to reduce some of that collapse of the airway and those apneic episodes overnight. In the past, a lot of patients were really hesitant to use CPAP, and I still find that that's a very common thing that patients will articulate to me in an office visit if we found that they do have a diagnosis of sleep apnea. However, luckily, sleep apnea machines and equipment for them have come a long way, and there actually is a lot more customization that we can do for our patients to make them more comfortable. There are different masks, either a nasal pillow or a mouth and nose part of the mask that can be used to improve patient comfort, and lots of other different ways that we can set up tubing and padding and straps to make sure that they are actually much more comfortable than initially seems possible with this cumbersome machine that they have to wear at night. It's also really important for us as clinicians to make sure that we're following up with patients shortly after they start their CPAP therapy, ideally within the first 2 weeks. This can help us to troubleshoot any issues that they have with their masks, with their fit, or potentially with their pressure settings that might be causing some discomfort or cause them to be less adherent to their CPAP over time. The American Academy of Sleep Medicine also recommends that we can use CBTI, or cognitive behavioral therapy for insomnia, to help alleviate some of that anxiety that patients might feel trying to use this machine for the first time. So we do have CPAP to address the immediate airway concerns, but there are some other options that are available to patients based on the severity of their OSA. For patients with mild sleep apnea, dental advancement devices might be an option. There are also hypoglossal nerve stimulators that can be placed to try to alleviate sleep apnea. And there are also surgical procedures that can help with either things like tonsillectomy or palate reconstruction that can also be a surgical way to address some of that upper airway obstruction that contributes to OSA. To address the underlying cause of OSA in patients with obesity, we now also have a medication that we can use. Tirzepatide is a GIP and GLP-1 receptor agonist that can be injected once a week to address the underlying condition of patients with obesity, and can also help with reducing some of that additional risk factor in patients for whom obesity is a strong contributor to their OSA. This medication is injected once per week. It can come with some GI side effects that are very important to go over with patients. It also helps reduce some of the comorbidities that we see associated with both OSA and obesity, including hypertension, elevated systolic blood pressure, and those elevated markers of inflammation. Tirzepatide is also indicated for patients that have a history of diabetes as well. And I say this because it's really important to be thinking of obstructive sleep apnea as part of a holistic approach for wellness for our patients. Not only just the OSA itself, but comorbidities such as diabetes and other downstream effects of both of these conditions. In tandem with using medications, it's also important to counsel about good nutrition, good lifestyle, good stress management, and of course, getting back to trying to get to that foundation of healthy and restful sleep. Treating patients with a comprehensive, holistic treatment plan is important for all patients with OSA, regardless of whether they do or do not have a diagnosis of obesity. It's also important to recognize that you can do both of these mitigation strategies at once. You can use a medication to help address the underlying causes of OSA, but also use CPAP therapy to address the immediate airway concerns while trying to work to reduce weight and risk factors for moderate to severe OSA. As always in medicine, we need to strive for shared decision-making with our patients. It's so important to recognize that this can be a really big change to a patient's nightly routine, and potentially the nightly routine for a bed partner. And acknowledging that this is going to be a significant change really helps to both alleviate some patient concerns at the beginning and help with adherence to treatment. There are many models for shared decision-making with patients, but I typically go through the following points that are most similar to the 3-talk model. The first step is team talk, talking about what a patient would prefer, what their hesitancies are, what their concerns are, and then ways that we can move through them and move forward. Option talk, going through all of the different options that are available for treatment, including the risks of non-treatment. And then 3, decision talk, deciding on a way forward that both takes all of these things into consideration and provides a realistic path forward for our patients that they feel comfortable with. In a condition with notoriously low treatment adherence, it is so crucial to understand patient concerns up front and then tailor treatment with them so that they can have a better chance of success moving forward. As PAs, we are so uniquely positioned to make a significant impact on both obstructive sleep apnea and obesity for our patients. Thank you so much for joining me for this learning series. I hope that these clinical pearls can help you to diagnose and treat OSA more effectively in your practice.